Hi. So it's a beautiful March afternoon. How do you like the new haircut? I got a new haircut. Yay or nay? I like it how it's piecey in the front like this. Sort of just funky, like I'm a rock star. But it reminds me a little bit of David Bowie and Labyrinth too, so I don't know how I feel. So this time last year, I was super busy. I was studying for the NCLEX, taking the NCLEX, passing the NCLEX, and then starting my new job. So I've been a nurse for a year, about a year now. And so I thought that this video, we would talk about the lessons I learned in the nursing program and how I know that I'm a nurse, and just some of the crazy things that happen in the hospital, the things that many patients don't know about. Insert photo of me graduating from the nursing program. One of the first things I learned was there are no textbook cases. My parents and myself, we spent a lot of money on textbooks. But when you become a nurse, you realize, unfortunately, a lot of things you need to learn on the job. And that's one of the things I regret, is I wish that I had more experience. One of the things my family definitely knows is I will talk about bodily fluids and really gross procedures at any moment, even during dinner, and they're really cool about that. Sometimes I don't have that censor button though to say, hey, this isn't a good time right now to talk about, you know, the patient's diarrhea that they had last night. My job is the one job that crap literally is my job. As a nurse, I'm crazy about pens. Like, you don't give any of your supplies, especially pens, to anybody. Those things disappear like crazy. I don't know where all my pens go. You know you're a nurse when you curse yourself because you forgot to go to the bathroom before you went to work. Because you're not going to be able to go to the bathroom for hours. You know, I start my shift at 7 p.m. and usually I don't get to sit down until at least 11 o'clock because I have 10 o'clock meds to pass. I have all my assessments to do on my patients. I would joke with the other nurse that they're like my babies. I have to make sure that all my babies are sleeping during the night. And you would think that they would sleep during the night. Everybody just assumes that because I work night shift, oh, it's so much easier because all the patients are sleeping. Yeah, right. The other night I had a patient who, she went crazy. She had something called sundowners. Sundowners is a condition that some patients will go through. It's especially elderly patients where they're confused during the night and they don't know where they are. She was thinking, she was a sweet little old lady before 10 o'clock, and then after 10 o'clock she said that we were all kidnapping her and what kind of nurses are we? We're the meanest nurses ever. And she had a broken hip. So we couldn't let her leave the hospital, obviously. Sometimes you get a night where you're doing nothing, and that's awesome. But there are other nights where you definitely earn your pay and you're running around like a crazy person. Please, 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 if you ever are in the hospital, be nice to your nurses. They're trying their best to help you. You know you're a nurse whenever you check out other people's veins. And this is so true. This is not like a creepy, like, oh, I love poking people and causing them pain and starting IVs, but, you know, sometimes I'll just look at my hands and I'll be like, ooh, that's a good one right there. I'm not that good. I am going to admit that right now. I'm not that good of an IV start. If somebody says they're a bad start, I'm not even going to touch them. I'm going to say, you know what, I'm going to go to a more experienced nurse and everything. But the other night, somebody said, oh yeah, I have great veins. And I could hardly get a 24 gauge, which is like the teeniest, tiniest of needles. And she was like screaming and saying, oh, you have to put it here. And if you're a nurse, you know, you do not want to put an IV here, especially if it's on a machine, because guess what you do? You bend your arm. You know you're a nurse if you think caffeine should be given IV form. Sometimes the only thing that gets me through the night is to know that I'm going to have a can of Dr. Pepper at my dinner time, which is usually I take my break around 1:30. I'm sure my metabolism and my sleep cycle and everything are completely messed up. You know you're a nurse if you believe in the underwear theory of documentation. You need to cover your butt. You need to document everything. Make sure that, you know, that nothing can come back and haunt you in court because you're not going to remember what you did to a patient a week ago. I'm not superstitious, but I've seen this happen. There are certain things that you never ever say out loud when you're working on the job. You should never say, "It can't get any worse." That's automatically it's going to get worse. Or, "Wow, it seems quiet tonight." It's not going to be quiet for long after that. You know you're a nurse if you've ever had a patient who has multiple tattoos. Tattoos all over their bodies, piercings all over their face, and they say, "I don't want to get any shots or IV starts." They wince every time you give them an IV. Like, okay, you know you're a nurse if you've ever run out of linens, IV fluids, medications, syringes, and patients all at the same time. This is the thing with our linen cart. It's always something different. Like, I'll go there and I'll be like, all I need is a pillowcase. There'll be everything. Draw sheets, regular sheets, blankets, no pillowcases. And we have 3 different linen closets and all of them will be out of pillowcases. Something I'm learning a lot is asking the most important assessment question during the night shift at 2 a.m. asking, "Is this an emergency really right now?" And saying, "Do I call the doctor or do I not call the doctor? Does the doctor really need to know this right now or not? Who do I call? Do I call our house doctor or do I call the attending?" I wish that we had covered that more in nursing school, because I'm kind of sick of doctors screaming, literally screaming at me for waking them up at 3 in the morning. And I have to ask myself, what are you getting paid for then if you're not on call? If you're a doctor, you're on call 24/7. I'm sorry. I got yelled at from a doctor for calling him at 11 at night because he said, you know, "I'm busy right now and don't ever call me after 11:30. If your patient is dying, I'm calling you. I don't care." I'm sorry for getting angry. You know you're a nurse if you've ever thought, "Wow, my shoes need to be confiscated by the EPA, OSHA, or the CDC. I've stepped in so much sticky stuff and dirty stuff. I've pretty much made it a habit that right before I come home, I will wipe the bottom of my shoes with a bleach wipe because they're that disgusting. And I don't want to bring that into my house. You know you're a nurse whenever you think the only way to work is to wear your pajamas. That was one of the things that I was so excited about when I became a nurse, was that I'd be able to wear scrubs all day. You know you're a nurse whenever you know that your patients are completely lying to you. I've had patients that come in and say, "Oh, my pain's a 10, I'm gonna die." And then they say, "But I'm allergic to Toradol, I'm allergic to morphine, I'm allergic to Tylenol, I'm allergic to ibuprofen." And by process of elimination, that leads you to Dilaudid, which is one of the biggest narcotics that we give out at our hospital. Hey, patients, when you say you're allergic to morphine, guess what else you're allergic to if you say you're allergic to morphine? You're allergic to Dilaudid, and you're not going to get any of it. Yeah, we're not stupid. We're not stupid. We know what you're trying to do whenever you say stuff like that. If you're a student nurse, get ready to become the resident nurse in your immediate group of friends. When you become a student nurse, get ready for 2 reactions. Either you're going to have the reaction of, "Hey, can I show you this? Is this normal?" Or you're going to get the reaction of, "Oh, I have a family member, or I have a daughter, or I have a son that is going into nursing. You need to talk to them and give them advice on what to do." I'm not the one to talk to right now, because sometimes I'm like, I want to pull my hair out, I want to quit, you know, right after I've just been at work, I want to quit, you know. I have panic attacks right before I go to work because I'm scared of what's going to happen and what I'm going to be dealing with. So this is not the right time to be asking me. Ask me what it's like to be a nurse 5 years from now. If you're meant to be a nurse, you should be a nurse. I'm scared that I'm going to be turning people off from nursing when they really are supposed to be a nurse, when they really are gifted and they should be a nurse. Downstairs, write your comments. What surprised you about nursing that I mentioned? If you found anything funny in this video, let me know. Or if you think this is dumb and you think I need to quit nursing, let me know. So I'll see you guys next week. Bye.